You make the doctor's appointment, note the time on the calendar, and assume the hard part is over. The expectation is that if the healthcare system schedules the visit, your health coverage will handle the logistics to get you there. But when the day arrives, that logic falls apart. Appointments are missed, chronic conditions worsen, or families are suddenly hit with hundreds of dollars in unexpected transport bills just to get a wheelchair van to the clinic. The confusion almost always traces back to two words that sound similar but operate entirely differently: Medicare and Medicaid. Let's map out exactly how these programs treat medical transportation. This diagram compares the two. On the horizontal axis, we separate them by program type. Medicare is federal and generally age-based, while Medicaid is state-run and income-based. On the vertical axis, we separate the types of transportation they cover: emergency ambulances versus routine, non-emergency rides. Notice the gap in the bottom left corner. For millions of older adults, the space where Medicare and routine transportation intersect is empty. This leaves patients and their caregivers facing a choice. You can spend hours navigating state requirements to get a ride covered, or you can pay out of pocket to ensure the ride fits your specific schedule. To understand why this happens, we need to define non-emergency medical transportation, or NEMT. This is the scheduled logistical support required to get patients safely to dialysis, physical therapy, or standard hospital follow-ups. This is not the lights and sirens of an emergency ambulance. Ambulances are strictly reserved for critical situations requiring immediate medical intervention during transit. NEMT is also different from calling a standard rideshare. These trips require professional driver assistance, specialized wheelchair lifts, or even stretcher-equipped vehicles to transport the patient safely. When a patient needs this specific level of transport but lacks the correct insurance coverage to pay for it, the medical system stalls. Hospital beds cannot be cleared for discharge, and clinics deal with schedule disruptions. If you do not know exactly how your insurance treats these specialized rides before the appointment date, you run a risk of being stranded at the curb or billed for the full cost of the trip. Let's break down the primary insurance pathways, starting with Original Medicare. For this group, Original Medicare provides zero coverage for routine, non-emergency rides to doctor visits. The one narrow exception is if traveling in another vehicle actively endangers the patient's health. Triggering this exception is difficult. It requires a doctor's written order explicitly stating medical necessity. This strict standard offers no help to a senior needing a wheelchair van for a checkup. Relying on Original Medicare means you retain the freedom to choose your doctor, but you are responsible for the logistics of reaching their office. Now, let's illuminate the Medicaid path, designed for specific financial needs. This pathway lights up green, covering routine, non-emergency medical transportation. But coverage has strict requirements. You must meet advanced scheduling deadlines and prove you lack alternative travel. You must route requests through a state-approved transportation broker. They evaluate the request, authorize the trip, and assign the vehicle. A patient cannot simply call a local transport company directly. The broker dictates the vendor. For caregivers, this turns a simple visit into a major project. They must submit paperwork, make calls days in advance, and monitor approvals constantly. Medicaid handles the bill, but the patient gives up control over timing and transport provider. A third primary branch focuses on patients using private insurers for Medicare Advantage. Some plans offer routine transportation, but reveal specific restrictions: capped ride counts, mileage limits, and mandatory pre-approved vendor networks. If you hold one of these policies, you must ask 3 questions. How many trips are included annually? Are wheelchairs or stretchers covered? And what is the allowed distance? Finally, the diagram zooms out to show the most complex scenario: the dual-eligible patient. This is an individual who qualifies for both age-based Medicare and income-based Medicaid. On paper, dual eligibility grants the broadest possible coverage. You theoretically have Medicare for necessary ambulances and Medicaid for routine appointments. In practice, this forces families or hospitals to accurately assess the vehicle needed and identify which program to bill to avoid immediate denials. While these plans offer transportation perks, they require strict administrative management to avoid triggering delays. When insurance pathways are too rigid, they often fail to meet the immediate reality of a patient's schedule. That is when private pay transportation becomes an option. The reasons for this are predictable. Medicare denies the routine trip, an Advantage plan's annual ride limit is exhausted, or a hospital needs to discharge a patient at 4 p.m. on a Friday and cannot wait 72 hours for a broker approval. Bypassing the insurance system removes the friction. As this booking screen shows, paying privately allows for immediate scheduling. You choose the vendor you trust, secure a specific pickup time, and ensure a specialized vehicle, like a stretcher van, is ready. The trade-off is straightforward. The family, the patient, or the facility pays for the trip out of pocket. Choosing to pay directly allows families to move on their own timeline, ensuring the ride is ready when the hospital discharge order is signed, regardless of insurance processing speeds. Choosing the right transportation method ultimately depends on which resource you value protecting: your budget, your benefit limits, or your time. Let's finalize your strategy with this scorecard, aligning your current priorities with the correct logistical path. If you are the budget optimizer relying on Medicaid, your goal is achieving zero out-of-pocket costs. To get that checkmark, you must follow the advanced scheduling rules and use the transport vendor the state broker assigns to you. If you are the benefit maximizer using a Medicare Advantage plan, you should use your allocated rides. Just track your distance and frequency limits so you are never caught off guard when the quota runs out. And if you are the time optimizer, paying directly out of pocket is a practical choice. It ensures punctuality for appointments and clears hospital beds the moment a patient is ready to leave. Health insurance is designed to cover the cost of your medical treatment, but defining the logistics to physically reach that treatment is your responsibility. And the best time to map that route is before an emergency strikes.